Mark, it's lovely to sit down with you again. We've obviously met before, but for people who don't know who we are, why don't you tell us a little bit about yourself?
My name's Mark. I'm a homeless health caseworker for Groundswell.
I'm Gethin. I'm an actor by trade. Last year, some wonderful colleagues introduced me to Groundswell, and everyone here has been incredibly welcoming and sort of letting me learn about what it is that you guys do. And this week being Diabetes Awareness Week is a really good opportunity to explain to people what it is Groundswell does. Because Groundswell is a homeless health peer advocacy service. Could you tell us a little bit about what that is?
Yeah, so homeless health peer advocacy is we support people experiencing homelessness, and by that I mean in a hostel, rough sleeping, threat of eviction. And by support, we will support them to access healthcare.
You're a diabetic. I'm a diabetic. That's why we first started chatting about this. Can you give us an example of a service user, what their life might have been like before working with Groundswell?
Yeah, so I remember vividly, I was working, I was volunteering at the time, and I came across a chap who had type 1 diabetes, was rough sleeping, and he shared with me at the time that he stored his insulin in a local canal in Canada.
In the canal?
In the canal.
So sort of like literally in the water?
Yeah.
Wow.
So at the time, that raised a big red flag for me. So I'd phoned up a GP and I said that what he'd told me, and the GP service couldn't really help me because he was rough sleeping.
Yeah.
He had nowhere to store his insulin.
And just for those who might not, we're both diabetic, we know insulin has to be refrigerated to stay in use. It goes off effectively. So he was storing it in the canal because he knew that he needed to keep it cold, and he had nowhere else to have a fridge. Right.
I raised it with the day centre and said, look, is there any news on his housing? Because he's in a desperate way. I found out a little while later that he had been rehoused, and I don't know how he's getting along now, but the last I heard, he was doing very well. His insulin was in the fridge.
Yeah.
And so things like that for me are very heartwarming.
Yeah.
And it was really like, wow, you've got a fridge to put your insulin, bread in your milk.
Yeah.
Brilliant.
Well, that's the amazing, because some of what you talked about before with people gaining confidence in what they can access to healthcare, I'm sure that must translate to other services as well. And of course, Groundswell, you guys work with other services who support people experiencing homelessness in different ways. So all of those coming together, and it's fairly obvious to most of us that, for want of a better phrase, health is wealth, and we have healthcare services in this country, and everyone has a right to access them. And one thing that I've learned from reading the information here is that 63% of people experiencing homelessness live with a long-term illness or condition, which just means that they need access to healthcare so vitally to stay alive, right? And without that healthcare, the outcomes are really quite terrible. So you're a type 2 diabetic.
Yeah.
You've had it since 2018. 17, 18. And what was your journey like into that? Because I got diabetes like overnight when I was 15. I got type 1. So what was your journey like into getting diabetes?
I was in a hostel at the time in Advocacy and Castle, and I was still going through the craziness of drinking, because I had a huge drinking issue. And I went for a blood test at my GP, and I said, oh, Mr. Leonard, do you know that you're diabetic, you're type 2 diabetic? I was like, none. I didn't know that. What do you want me to do about that? Oh, well, we need to set you on medication. And luckily enough, I started to wean down my drinking, which helped with my diabetes management, because I was remembering to take the medication and eating slightly healthier. But yeah, that's been 2017, 2018 I was diagnosed.
So you, over the last 5 years, you basically learned how to take care of a long-term condition, type 2 diabetes. What are some of the things you've sort of had to learn along the way to deal with that?
The GP actually signposted me, sent me to a diabetic management course in St Thomas's Hospital, where they teach you how to manage your portion sizes, so a bit of fibre, a bit of carbohydrates, a bit of, so food management, how much to eat, how much not to eat. But for me, it was very difficult to try and live a healthy lifestyle. When I was in a hostel, when the food they served up for dinner wasn't that great, a lot of carbohydrates, and that used to send my sugars spiking through to insane levels.
And that's just a reality that comes with being a diabetic. Is it that it's hard to manage when you have all the options in the world, and when you're not necessarily in control of what you have available. It just becomes exponentially harder, I can imagine. And you've been through that, you've grown through that, and then now you're helping people deal with similar issues of maintaining long-term conditions over time whilst experiencing homelessness, which is, as we know, it's just incredibly tough. Are there any specific things that you learned from your own experience that you use in your work?
Yeah, I mean, I've got a service user at the moment that has type 2 diabetes, and she wasn't too sure on whether she is or isn't diabetic. I said, well, what's your number on your diabetes score? What's the number they've given you? And she said, 48. I said, yeah, you're diabetic and you need to be at, I think, 44 to be pre-diabetes or borderline. She was like, how do you know that? I said, oh, I've got diabetes as well. And that just really helped. She said, it's really hard to get off the cake and the biscuits and the healthy food. I was like, yeah, it is, isn't it? It is hard. So I wasn't the cake police. It's just about managing how many portions you eat and stuff. And then she recently told me that her GP told her that her sugars had gone down slightly. So they're going in the right direction. Yeah. I think we celebrated with a piece of cake after, but it's fine. I mean, it's okay.
I've definitely done that. Celebrated a good HbA1c with a chocolate bar. Mark, you mentioned everyone has a right to receive healthcare in a GP surgery, which is something I know because I read it on your amazing resources up here. So can you tell me a bit about how these came to be, and especially this one, what it is that they do?
So our resources here are called action updates, and they are actually developed by our caseworkers and volunteers at Groundswell who have had lived experience of homelessness. So they would do a focus group on what we'd like to see on the action update.
I'm pretty slow, so let's see if I can understand this. Right, we all have the right to good health and to access healthcare. That's pretty clear. Everyone has a right to register with a GP. You do not need a fixed address. You do not need identification. Your immigration status does not matter. So that's a really clear sort of poster, so that everybody can, as many people as possible can understand that those are pretty clear, including GPs and GP receptionists, presumably. As I mentioned to you, I've been a diabetic for 20 years now, probably a bit more actually, 25 years, I should say. And over that time, you use a lot of medication, a lot of equipment. I'm so grateful for, I've had the fortune of being in quite a stable environment throughout the time. It's still very hard to manage. It's still a bit of a burden. And there was a time a few years ago where I had a bag lost, basically, while I was traveling, and I lost my insulin pen. And I was quite quickly in need of healthcare. I had to go to the GP that morning and see if I could just get another pen prescribed, so I could go straight to the chemist rather than going to A&E or something and clogging out that service. I was like, well, it's GP's Crossroad, I'll just go to the GP. But essentially I was like plummeting into, or rather ascending into high sugars, so I guess call it that way, but I was getting pretty sick pretty quickly. And I I'll never forget the feeling of I had a GP asking me before he gave me the prescription in quite a stern tone, do you know how much this costs? Which I don't, who knows what his day had been like. Maybe he was having a bad day. Maybe he'd just been given a briefing about budgets. And I can understand all that. We know that the people who work in the NHS work incredibly hard and they're put under a lot of pressure. But it just seems so bizarre to me that I was sat in front of him sweating out. My sugar's rising and rising. I was in somewhat of a panic. And that was the moment to check in if I understood, because, it's one of those things that I felt pretty small in that moment because I needed that insulin. I needed it so bad, and I would have done anything. I would have gotten on my knees and begged for it. And obviously that doctor did not make me do that. But just that hint of do you understand what you're getting, just made me really think about a little bit about what you've touched on, about how one might be aware of themselves in a space where they're being provided with a service, which they have a right to. They're absolutely deserving of, because they just are. So it's kind of essentially the work translates day in, day out, week in, week out, to just solving these sort of kind of glitches of problems of people just getting access that they deserve.
Yeah, I mean, it's not all glitches, but I do feel that if we weren't there, then they would get fobbed off.
So because every example that we sort of come to of people's experiences like this is like, these are people on the main who are trying to rebuild their lives in some way, potentially, or get out of the situation they're in. Would that be fair? Am I making an assumption there? Or on the whole, people are working towards changing the situation they're in?
Yeah, I mean, there are other low life factors that go on with our client group. Universal credit, hostel, mental health issues, recent bereavements, all a vast many problems that they're facing.
Right. And I think something that I still can't get my head around is that the average age of death for someone experiencing homelessness is 44, which is something I've learned by learning from you guys here, and I can't get around how young that is. The work that you guys do at Groundswell saves lives. It changes lives for the better. It's incredibly inspiring and humbling to meet you all. And I mean, it goes without saying, really, that people's health is a lifelong thing. I think you deserve all the support we can give you, which in the form of, if you're out there listening, tell people about Groundswell, make a donation if you can, because it's incredible work. And thank you for your time today.
Thank you, Gethin.